This has been a more aggressive Ebola outbreak than we've seen in the past, but keep in mind that it is still affecting parts of 3 countries. Keep in mind that Ebola is not something that is easily transmitted. That's why generally outbreaks dissipate. But the key is identifying, quarantining, isolating those who contract it, and making sure that practices are in place that avoid transmission.
Does the president have it right there?
He's exactly right. So the guy that discovered Ebola virus in 1976, Peter Piot, now runs the London School of Tropical Medicine, one of the most preeminent organizations in the world for studying this kind of thing. And he said he would confidently sit next to someone on the subway with Ebola. And he's right, it's hard to spread. So the way we think about Ebola is not to worry about vaccines and treatments. In the long term, we have to worry about that. But immediately, what we need to be doing is containing this epidemic in West Africa and pouring money in. So the epidemic is getting worse insofar as there are more people dying now before, but it's not a very different situation to 3 weeks ago when we weren't talking about it and the WHO wasn't spending $100 million.
Okay. So when you, however, say that the keys are, and also when the president says identifying, quarantining, isolating, and then what I hear is that there are military personnel in many of these nations that are now tasked with doing that. And these are nations that have just come out of bloody civil wars where the appearance of military isn't exactly comforting in their local communities. Is there reason to believe that the very things we need to do may be the very hardest things to do? That, in fact, if we were just vaccinating people, it might be an easier task on the continent.
This kind of public health is no fun at all. So it involves changing people's lives dramatically in West Africa. There'll be curfews, there'll be military hunting, seeking out patients and potentially compelling them to be isolated or treated. So it's not a very nice situation, and we should have been doing this months ago when it was still in Guinea, when it was containable. The problem is that no one ever got a medal for preventing an Ebola epidemic because there was no Ebola epidemic. What you get is a medal for responding to it. So prevention is always underfunded. What we should be worried about is the fact that if this was flu, we would be panicking in New York. And
why? Tell me.
Flu spreads differently. Flu's airborne. It's easier to catch, and you're contagious before you're symptomatic. So if you imagine a virus like HIV, HIV is a great virus for spreading an epidemic because you can be asymptomatic for years, give it to hundreds of people. Ebola, you're so symptomatic, people can go, you've got Ebola, you're not going to be kissing them, you're not going to be touching them, and you're going to be moving to the hospital.
But in the case of HIV, in the case of flu, and in the case of Ebola, we still are in that reality that you said where prevention is underfunded, that we focus on it so much less, and so when we have diseases that spread easily, we are not well suited for the prevention side, is that?
That's what we should be worried about here, is what we're seeing is a failure of the international system to respond to this virus. And this is a virus that we should care about for humanitarian reasons. These countries are really neglected, and that's why it's spreading. There was a survey that Samaritan's Purse did a couple of days ago in one of the big markets in Liberia, and they asked 1,000 people, and 90% of them didn't believe Ebola exists. This is not a region the West has treated well over the historical period. They've got good reasons not to trust us, and so we should be investing in the long term.
So you've both made me feel better that it is unlikely to become an epidemic here in the U.S. and made me feel worse about the fact that it is a crisis on the west coast of Africa. Thank you to Dr. Alexander Van Tulleken, and that is our show for today. Thanks to you at home for watching. I'm going to see you tomorrow morning, 10